Good afternoon, everyone. Thank you for giving me the opportunity to present my abstract at COLDA 2021. Today, I will be speaking on the Prolifica Gambia experience with the long-term follow-up of chronic hepatitis B patients in Africa. 60 million individuals live with chronic hepatitis B in Africa, with a prevalence rate of over 8% in adults and over 3% in children under 5. Chronic hepatitis B is one of the leading causes of death in Africa. According to current guidelines, chronic hepatitis B patients require lifelong monitoring, and the resources to monitor these patients are scarce in Africa. It's also coupled with the limited data on the best practices for long-term follow-up of chronic hepatitis B patients in Africa. Therefore, it's crucial to develop follow-up strategies using local evidence, which will limit the loss to follow-up and also retain patients in care. The Prolifica study is the first screen and treat program of chronic hepatitis B in Africa. Between 2012 and 2016, mass surface antigen screening for hepatitis B was done at communities and blood banks in Western Gambia. Community sensitization was done for adults 30 and over. Then we did a mass screening using point-of-care test kits at the communities and also at health centers and hospitals. We screened over 11,000 adults, 1,216 of them were surface antigen positive. 702 of them were successfully linked to care, plus an additional 450 from the health centers from a HC4 study and a historical cohort in the villages of Mandouar and Kenepa. We ended up with a total cohort of 1,152. At their enrollment, we collected their telephone numbers and home addresses and that of their next of kin. It was set on a separate database for confidential reasons. We followed up patients 6 to 8 years after enrollment. Then between 2018 and 2020, we retrieved their contact information and then started making telephone calls to either the patients or their next of kin. We would try to call the patients at least 3 times, them or their next of kin. If we do not get them at least 3 times, we would then do a home visit to check if they still lived at that address. If we were unable to find them at that address, we would speak to their neighbors without giving any medical information to ask if it was possible to get their new addresses or their new phone numbers. If no contact was made with a patient or their next of kin, after 3 phone calls and a home visit, we would then declare the patient lost to follow-up. Between October 2018 and November 2019, we contacted 1,152 patients. Of those patients, 82.5 were alive, 11.8 were lost to follow-up, and 5.7 had died. Of the 82.5 who were alive, 78.9 accepted to be seen and reassessed in clinic, while 7.4 had traveled outside of Africa, 10.6 had refused. 96.3 of the patients were successfully reassessed. 82.2 were seen in clinic, while 13.5 were seen at home because they were unable to come to clinic, and we did an outreach clinic to meet them in their villages. Half of the patients did not give any reason why they refused to be followed up, but the patients that gave reasons were 16% of them did not like the blood collection, which was needed to do their viral loads, while 7% their spouses had refused because we live in traditional Gambian societies, and if we could not reach a patient, we would then have to call their next of kin, which is their spouse, who insisted on getting the patient's medical information before they would allow them to come into clinic to follow up, which we told them we could not do, so they did not allow their wives to come to clinic to be followed up, and they did not allow us to go to their homes to follow up their wives at home. Cause of death was not known for half of the patients, but for those who cause of death was known, 33.3 had died of chronic hepatitis B related conditions, while 9.0 had died of non-chronic hepatitis B related conditions. The place of death was not known for 39 0.4% of the patients, while 34.8% had died at home, 24.2% had died at a health facility, while 1% had died at a traditional healer's home. In conclusion, following up patients long-term using phone calls and home addresses is feasible, and it's also cheap it's also affordable for countries, for continents like Africa who have limited resources to follow up patients long-term. However, this strategy is limited by the changing of phone calls and patients moving without informing their clinics or traveling within or outside of Africa. However, hepatitis B clinics should collect as much contact information as they can and constantly update this information whenever the patient comes into clinic or they call the patients to relay their visit outcomes. They should collect as much as they can so they're effectively able to monitor patients long-term. We also realized while following up the patients that sharing visit outcomes and test results and teaching them and sensitizing them about chronic hepatitis B has helped us retain patients in care because they now understand the importance of them being followed up, which would in turn improve their quality of life. I would like to acknowledge my colleagues from all over the world and also our collaborators and our funders. We wouldn't be able to do all that we're doing for our patients without them. I'm most grateful for the Prolifica patients and their families for supporting them through their follow-ups and constantly making themselves available when they're needed and bringing in their families to be followed up in clinic. Thank you very much.